Medical expert gives urgent warning over 7 silent killer cancer symptoms. News. A doctor has issued a warning about some silent killer cancers and their early warning symptoms that people should get checked out. Individuals often don't go to their GP when displaying these signs, as they're often dubbed not severe enough to seek medical attention for. But this gives the cancer the chance to grow and makes treatment even more difficult. They can also overlap with less serious conditions, adding to the idea that people don't need to visit their doctor for them. The term, unquote, silent killer unquote, is used to describe cancers that sometimes don't cause any noticeable early symptoms. To help people identify when they should seek help, From has shared 7 examples and the risk factors behind them. They include bowel, cervical, liver, lung, and ovarian, prostate, and pancreatic cancer. Bowel cancer. This is one of the most common cancer types in the world, mostly affecting those over the age of 60. Common symptoms include persistent abdominal pain, bloating, cramps and changes in your bowel habits, constipation, diarrhea or thinner stools. You may also notice blood in your stools, have the urge to open your bowels even after recently passing stools, and unintentionally lose weight. Age is one of the biggest risk factors, but you should also take into account family history and habits like smoking and drinking. Cervical cancer. Cervical cancer is a cancer that's found anywhere in the cervix. It grows very slowly and can often be detected through a cervical screening test. Common symptoms include vaginal bleeding in between your periods, during or after sex and after menopause, heavier periods, changes to your vaginal discharge, pain during sex and pain in your lower back, lower abdomen and pelvic area. According to Dr. Cervical cancer is more common in those aged under 45, those with a weakened immune system. For example, due to HIV or AIDS. Your risk of cervical cancer is also higher if you've given birth to children before age 17, had multiple births, have not been vaccinated against HPV or previously had bladder, kidney, vaginal or vulvar cancer. Liver cancer. This is found anywhere in the liver, and the danger depends on where it's found and how big it is. A lot of the symptoms relate to digestive issues such as nausea, vomiting, paler stools, and darker urine, feeling full after eating only a small amount of food. You may notice a lump on the top right side of your abdomen, feel pain in this area, and experience abdominal swelling that isn't caused by eating. Other symptoms include jaundice, where the whites of your eyes become yellow, pain in your right shoulder, unintentional weight loss, loss of appetite, fatigue, fever and feeling unwell. You're more at risk of developing this cancer if you are male, have a family history, are aged over 60 or if you have diabetes, hepatitis or liver flukes. Lung cancer. This is a very serious yet common form of cancer, more people in the world being diagnosed each year. Symptoms include a persistent cough, breathlessness when performing activities that usually aren't a strain, coughing up blood, fatigue, loss of appetite, pain in your chest or shoulders, repeated or persistent chest infections, and unintentional weight loss. Smoking puts you at a bigger risk of developing this cancer, as well as toxic chemicals like asbestos, arsenic and coal fumes, exposure to high levels of radon gas. Ovarian cancer. Ovarian cancer mostly affects those over the age of 50, but anyone with ovaries can be diagnosed with it. A lot of the symptoms are similar to that of a period, including abdominal bloating, back pain, fatigue and persistent pain or tenderness in your pelvic area. Other symptoms include constipation, diarrhea, loss of appetite, feeling full after eating only a small amount, unintentional weight loss, sudden urges to urinate and urinating more often. The risk of developing ovarian cancer gets bigger as you age, but also with a family history, have endometriosis or diabetes and have never used any hormonal contraception. Pancreatic cancer. This cancer affects the pancreas and symptoms include bloating, changes in your stools, constipation, diarrhea, nausea and vomiting. You may also experience back pain and pain in your upper abdomen, which feel better when you lean forward and worse when you lie down or eat. Other symptoms include jaundice, where the whites of your eyes become yellow, unintentional weight loss, loss of appetite, fever and fatigue. You may be more likely to get pancreatic cancer if you are over the age of 75 or have a family history. Certain medical conditions also increase your risk, including chronic pancreatitis, diabetes, gallstones and metabolic syndrome. 138,301,386,042 prostate cancer. Prostate cancer usually develops slowly, so there may be no signs for many years. Symptoms of prostate cancer usually only occur once the tumor is large enough to press against the urethra. Symptoms include difficulty urinating, needing to urinate more often and the sensation that your bladder is not completely empty even after urinating. Your risk of prostate cancer increases with age, and if you are overweight or obese, or have a close relative who had prostate cancer, your risk is also increased due to ethnicity as well as diet. Conclusion: it is crucial to be aware of these silent killer cancers and take proactive measures to reduce the risk. Regular checkups, cancer screenings, maintaining a healthy lifestyle, and being attentive to any unusual or persistent symptoms are essential for early detection and treatment. Medical experts are urging us to assess for early warning signs. Some cancers can have symptoms that people don't get checked out until it's too late.
Medical information disclaimer. This video contains general medical information. The information in this video is only for educational purposes. The medical information is not advice and should not be treated as such. You must not rely on the information in our videos as an alternative to medical advice from your doctor or other professional healthcare provider. My channel Health Tips by Shah Ji provides valuable information on how to stay healthy and fit. You can learn about the latest health trends and tips to help you stay healthy. Health Tips by Shah Ji is the perfect resource for anyone looking to improve their overall health and well-being.